Hello, my dear friends. I'm Dr. Vaishali Bharambe, Professor Anatomy. Today we are discussing the anatomy of pneumothorax. So we go to pneumothorax. Okay. So basically, what is pneumothorax? Presence of air in the pleural cavity. How does air enter? When the air enters inside, that negative intrathoracic pressure is lost. Okay. So this causes pressure on the lungs and the lungs begin to collapse. Can you see the lung collapsed here? This is air which has entered pleural cavity and therefore the lung has collapsed. An MCQ for you. Air entering pleural cavity in pneumothorax separates which two layers from each other? Visceral pleura lung parenchyma, parietal pleura thoracic wall, visceral parietal pleura endothoracic fascia. Answers too easy, but still, visceral and parietal pleura. So again, an explanation there for you to read on your own. You can pause the video and read. Students, if you like the lecture, then do please like, share and subscribe to my channel and hit that bell icon. Also, if you want more of these lectures, if you want surgical anatomy related lectures, diagram and downloadable notes as well, then visit my website vbanatomy.com. Let's continue with our discussion on pneumothorax. What are the causes of pneumothorax? It can be a penetrating thoracic injury. The lung bulla can explode into the pleural cavity. Opening of pleural cavity by a surgeon who is actually operating on the kidney, as we discussed in the earlier lecture. All these can be causes of pneumothorax. So what happens? When air enters inside, question is, what is mediastinal flutter and why does it occur? Just imagine that there is a hole in the pleural cavity here. Air is entering in. Every time air enters in, it pushes, because it's air by itself occupies space in your thorax. So the lung gets pushed to the opposite side. Okay. Every time the patient breathes out, the air goes out from the space and the lungs are able to come back. So the whole mediastinum moves to the opposite side, comes back, moves to the opposite side, comes back. This is called as a mediastinal flutter. Can you imagine your entire heart and the lung of one side are moving to one side and back again, moving to one side and back again? Mediastinal flutter. Okay? Right. This is an open pneumothorax. Occurs when air enters pleural cavity through an open wound. Entry of air, exit of air is free. The condition is not less dangerous. It is dangerous. But there is an open entry and exit of air. With each inspiration, mediastinum is fluttering to one end, to one side, and with expiration coming back to its normal position. Versus another condition which is called as a tension pneumothorax. Now this is something very interesting and very dangerous. Now here you are looking at, it's a life-threatening condition. Here you are looking at a little gap in the thoracic wall. Okay. But this gap is peculiar because this opening is acting as a unidirectional valve. It is allowing air to enter in, but when the air tries to escape, it closes off. It's a unidirectional valve. Only air is able to enter, it cannot exit. Okay. So now every time the patient breathes in, air enters inside, pushes the lung, mediastinum, heart, everything to the opposite side. Okay. But when the patient tries to breathe out, can he breathe out from that gap? No, the gap is closed, unidirectional valve. So the pressure in that space rises. With every breath, air is coming in, but air is not able to go out. This is an absolute emergency. Okay, this is what you watch in so many movies when suddenly they put in a tube inside patient's thorax and suddenly the patient is breathing. This needs immediate decompression, otherwise it is life-threatening injury. Okay, can you see the pressure building up here? Because this pressure is building up, the contralateral lung, which is not injured, also begins to get severely compromised, compressed. Patient is just dying of lack of breath. Okay, let's look at an MCQ to understand this. In tension pneumothorax, air continues to enter pleural cavity through inspiration but cannot escape during expiration because A. Rupture of alveoli in the pleural sac. B. One-way valve effect on the site of pleural tear. You know that's the answer, but let's read the rest. Collapse of trachea during expiration. Closure of costodiaphragmatic recess. No. So the answer is B. One-way valve effect at the site of pleural tear. I'm sure you got that. Let's just revise quickly why is B the answer. The tension pneumothorax occurs because the opening in the parietal pleura acts as a one-way valve. This causes the air pressure to increase within the thorax, compressing the mediastinum, compressing the lungs, the great veins, the heart, and this needs immediate decompression. That is tension pneumothorax. So we studied open pneumothorax, we studied tension pneumothorax. Students, if you liked the lecture, then do please like, share and subscribe to my channel. And visit my website www.vbanatomy.com. Many of these lectures, many which are not even released on YouTube, a lot of surgical anatomy lectures, joint label videos, and a lot of downloadable notes. MCQs are all available on my website. I welcome you to go explore that. Thank you.